Welcome to the deep dive, where we take a bunch of sources and really try to pull out the key insights for you.
Glad to be digging in again.
Today, we're tackling something, well, almost every pet owner bumps into eventually: acute vomiting.
Yep, it's super common.
But it can range from, no big deal to a real red alert emergency.
Mhm.
And figuring that out, that takes some serious veterinary sleuthing.
Absolutely. We've been looking through a veterinary study guide, some related materials, all focused on acute vomiting in dogs and cats, the causes, the diagnosis, the treatment.
So our mission here is to basically extract the must-know info from these sources. We want you to understand what vets mean by acute vomiting,
Yeah.
what's actually happening in your pet's body, the huge range of things that could be causing it,
Right.
what vets are looking for, how they approach figuring it all out and, getting the pet feeling better. It's kind of a shortcut to being really informed on this specific important topic.
And it really does highlight the challenge for vets that one symptom points in so many directions.
Okay, let's dive in. First up, what is acute vomiting, technically speaking? And maybe just as crucial, what isn't it?
Good starting point. So acute vomiting, based on the sources, it's a forceful expulsion of stomach contents, sometimes stuff from the upper intestine too.
Yeah.
It's driven by a neurological reflex.
Forceful.
Yeah, active. And acute just means it starts suddenly, and it's short-lived, usually less than, say, 3 to 5 days, maybe up to 7 days, depending on the source.
And you mentioned what it isn't. I know the first big hurdle is telling it apart from regurgitation.
Exactly.
Yeah.
Critical first step. To an owner, they might look the same sometimes, but physiologically they're totally different. Vomiting originates from the stomach or that first part of the intestine, the duodenum.
Right.
It involves that complex brain reflex. Regurgitation, that's from the esophagus, maybe the back of the throat. It's much more passive.
So how do you actually tell the difference? What are the clues?
The sources lay out some key things.
Hmm.
First, think about the effort. Vomiting is active. You see the belly muscles contracting, that heaving motion, retching.
Right, the whole body's involved.
Definitely. Regurgitation is passive. It's
Right.
effortless. The food or water just seems to, well, fall out.
Any warning signs?
Usually with vomiting, yeah. There's often what's called a prodromal phase. The pet seems nauseous. They might lick their lips a lot, drool, act restless.
Okay.
Regurgitation typically happens with zero warning. Just poof, there it is.
And the timing, does that differ?
It often does. Vomiting can happen, hours after eating once digestion has started. Regurgitation is usually immediately after eating or drinking or very soon after.
Makes sense if it hasn't really reached the stomach yet.
Exactly.
Yeah.
And the material itself looks different. Vomit usually has partially digested food, maybe some yellow-green bile, stomach fluid, sometimes blood, either fresh red or digested, looking like coffee grounds.
Okay.
Regurgitated stuff. It's usually undigested food. Often it's still kind of tube-shaped, like the esophagus, and it's covered in saliva or mucus, not bile.
And because vomit's from the stomach, it's acidic.
Right. Acidic pH regurgitated material is generally alkaline because it hasn't mixed with stomach acid.
The sources also mentioned dysphagia, difficulty swallowing, as something else entirely. So, getting this vomit versus regurgitation thing right straight away is huge for diagnosis. Points you toward the stomach and intestines, or toward the throat and esophagus.
Absolutely fundamental. It sets the whole diagnostic path.
Okay, so we know it's this active, forceful reflex. Let's talk about how the body actually orchestrates that. It's not just a simple stomach squeeze, is it?
No, not at all. It's a really complex reflex coordinated by a specific spot in the brainstem, the medulla oblongata, called the vomiting center.
A control center.
Pretty much.
Oh.
And this center gets signals from several different places in the body. That's why so many different things can trigger vomiting.
What kind of input are we talking about? Where are the alarms coming from?
Okay, one major one is the chemoreceptor trigger zone, the CRTZ. Think of it like a chemical sensor or a poison detector for the blood. It sits in the brain, but crucially, it's outside the normal blood-brain barrier. So it can directly sample the blood for troublesome substances,
Like what?
like certain toxins that have been absorbed, some drugs, certain antibiotics, chemotherapy drugs are classic examples, or even metabolic waste products that build up if the kidneys aren't working right, or with diabetic problems.
Wow, okay.
These things stimulate the CRTZ, which then sends signals using specific neurotransmitters like dopamine, serotonin, to the vomiting center.
Interesting.
And, side note from the sources, cats apparently have fewer of certain receptors, like dopamine receptors, in their CRTZ compared to dogs. That's why some anti-vomiting drugs like metoclopramide aren't as effective in cats.
Huh. Good detail. So bad stuff circulating in the blood is one trigger. What else?
Then you've got signals coming directly from the gut itself. These are from sensory nerves called visceral afferents, located in the stomach wall, the intestines, the pancreas, the lining of the abdomen.
So physical things.
Yeah, they sense things like stretching, say, from a blockage, or just too much food, or irritation and inflammation within the GI tract. The sources mention the duodenum, that first part of the small intestine, is particularly packed with these receptors.
So an upset stomach or something stuck sends a direct signal. Makes sense.
Yep. Then there's the vestibular system, the inner ear stuff that controls balance.
Motion sickness.
Exactly. Signals related to motion or inner ear problems go to the vomiting center. And finally, even higher brain centers can play a role.
Like thoughts or feelings.
Sort of. Things like intense fear, anxiety, severe pain, even really unpleasant sights or smells can sometimes trigger vomiting through pathways from the cerebral cortex. Psychogenic vomiting, they call it.
Fascinating. So the vomiting center is getting potential vomit. Signals from the blood, the gut, the inner ear, and even higher up in the brain. When it decides, okay, we're doing this, what actually happens in the body?
It triggers a very coordinated sequence. First is that nausea phase we mentioned, the lip licking, drooling, restlessness.
Yeah.
Then comes the retching. This is where you see those strong rhythmic contractions of the abdominal muscles and the diaphragm, but the airway opening, the glottis, is closed. It builds up pressure.
That drives.
That's it. And finally, the expulsion phase, the actual vomiting. This involves really powerful muscle contractions, the valve at the top of the stomach relaxing, the esophagus opening up, the airways snapping shut to protect the lungs, and even breathing stops for a moment. It's quite the event.
Sounds pretty violent physically.
It can be. Definitely puts a strain on the body, especially if it's repeated.
Right.
And that leads to potential complications. The sources list things like dehydration, obviously, from losing fluids.
Right.
Also electrolyte imbalances, losing potassium, sodium, chloride, which can mess up body functions. There's a risk of aspiration pneumonia if vomit gets inhaled into the lungs.
That sounds bad.
Very bad. And even esophagitis, inflammation of the esophagus from all that stomach acid coming out.
Okay, that covers the what and the how. Now, the really big question, the why. What's on the vet's list of suspects when a pet comes in with acute vomiting? This seems like where it gets complicated.
Oh, it does. The list of potential causes is enormous, which is why the systematic approach is so key. The sources generally break it down into two big buckets. Problems originating within the gastrointestinal tract itself, primary GI causes,
Okay.
and problems originating outside the GI tract, but affecting the body systemically and causing vomiting, extraintestinal or systemic causes.
Let's start inside the gut. What are the common GI culprits?
By far, the most frequent cause, according to the sources, is dietary indiscretion or just acute gastritis.
The classic got into the trash scenario.
Exactly. Eating garbage, spoiled food, maybe swallowing some weird but passable foreign material, or even just a really abrupt diet change. A lot of these cases are self-limiting, thankfully.
Okay, so that's number one. What else in the GI tract?
Gastrointestinal foreign bodies are definitely high on the list, especially in younger animals who chew on everything.
Yeah.
These can cause partial or complete blockages. And the sources emphasize linear foreign bodies like string or ribbon are especially dangerous because they can cheese wire through the intestines.
Yikes. I've heard horror stories about string. What about infections or inflammation down there?
Yep. Acute enteritis or colitis inflammation of the small or large intestine. This can be from infections viral, like the dreaded parvovirus in puppies, bacterial infections like salmonella or parasites like giardia. Also, acute pancreatitis, inflammation of the pancreas, is a big one. The pancreas sits right next to the gut.
Right.
In dogs, it's often linked to eating a high-fat meal. They're not always. In cats, it's often more idiopathic, no clear trigger. It causes intense local inflammation and can make the animal really sick systemically.
Are there like structural problems too?
Yes. Intussusception, where a piece of intestine telescopes into the piece next to it. You see this more often in young animals, sometimes secondary to severe diarrhea. And then there's gastric dilatation volvulus, or GDV, bloat with stomach twisting. This is a major life-threatening emergency, mostly seen in large, deep-chested dog breeds.
That one's terrifying.
Absolutely. Other GI causes include ulcers or erosions in the stomach or duodenum, maybe from certain drugs like NSAIDs or foreign bodies rubbing or even certain tumors. And there are others listed like severe hemorrhagic diarrhea syndrome, AHDS, severe constipation causing backup, or even inflammation of the whole abdominal lining, peritonitis, maybe from a ruptured gut.
Wow. Okay, so that's a lot just within the digestive system itself. Now, what about the things outside the gut that can make a pet vomit? the systemic causes.
This is where it gets really interesting because these conditions often mimic primary gut problems. Metabolic or endocrine disorders are a major category here.
Like hormone problems.
Exactly, or issues with body chemistry. For instance, acute kidney injury, AKI. When the kidneys suddenly fail, waste products called uremic toxins build up in the blood.
Back to the CRTZ.
You got it. They stimulate the CRTZ and directly irritate the stomach lining. Then there's diabetic ketoacidosis, DKA, a serious complication of diabetes. The body becomes acidic, produces ketones.
Also hitting the CRTZ.
Yep. And then there's the great pretender, hypoadrenocorticism or Addison's disease.
I've heard of that one being tricky.
It really is. It's a deficiency of adrenal hormones. It messes up electrolytes, blood volume, the body's stress response. And it very commonly causes vomiting, diarrhea, lethargy, looking exactly like severe gastroenteritis sometimes.
That's a critical one for vets not to miss then.
Absolutely crucial. That's why testing for it is often part of the workup for severe unexplained GI signs.
Okay, so kidney failure, DKA, Addison's. What other systemic things?
Hypercalcemia, high blood calcium. This is being caused by certain types of cancer like lymphoma or other issues. High calcium irritates the GI tract directly and affects kidney function. Also, severe electrolyte problems like very low potassium, hypokalemia can actually slow down gut movement, leading to ileus and vomiting.
What about the brain again, or system-wide toxins?
Definitely. Neurologic disorders like vestibular disease, that inner ear issue can cause vomiting. Or increased pressure inside the skull from, say, a brain tumor or inflammation.
Right, the vestibular and higher center inputs.
Exactly. And systemic toxins, poisons that get absorbed and affect the whole body, not just swallowed irritants. Things like antifreeze, ethylene glycol, lead. Those hit multiple systems, including triggering the CRTZ or vomiting center.
Okay.
Also sepsis, a severe body-wide infection or inflammation. The inflammatory mediators released can trigger vomiting. Severe liver disease can too, as the liver can't clear toxins effectively. And don't forget severe pain or stress from any source, a broken bone, major surgery that can trigger vomiting via those higher brain pathways.
So even something like a really bad ear infection or significant pain elsewhere could be the root cause of the vomiting.
It could, yes. The list also includes things like uterine infections, pyometra, in intact females, which cause systemic illness, or even specific parasites that cause broader problems. It's a lot. And this huge list explains why the diagnostic approach has to be so careful and methodical.
Okay, my head is officially spinning with all those possibilities. Dietary mistake, swallowed toy, kidney failure, Addison's, pancreatitis, brain issue. How on earth does a veterinarian start to untangle that mess and figure out what's actually wrong with this particular sick pet?
Right. That's where the detective work really kicks in. It's all about gathering clues systematically.
Playing detective, I like it.
Yeah.
So where do they start the investigation?
It always starts with a really thorough history taking. You, the owner, you have the first pieces of the puzzle.
Okay.
The vet needs to know the basics: age, breed, sex, signalment, because some conditions are more common in certain groups. Young animals get parvo or eat stupid things more often. Large, deep-chested dogs are prone to GDV. Certain breeds get Addison's or pancreatitis more.
Right, predispositions.
Exactly.
Yeah.
Then they need all the details about the vomiting itself. When did it start? How frequent is it? What does the vomit look like? Undigested food, yellow bile, clear fluid, foreign stuff, blood. Is it related to eating or drinking?
What else do they need to know from the owner?
Oh, lots. Any other signs? Diarrhea? Is the pet lethargic, refusing food? Any signs of belly pain? Drinking or urinating more than usual? Any collapse episodes? These associated signs are hugely important clues. And then potential exposures. Any recent diet changes? Could they have gotten into the garbage? Any missing toys or household items? Access to potentially toxic plants or chemicals? Are they on any medications, especially things like NSAIDs? Could they have access to antifreeze, rat poison?
Okay, covering all the bases.
And relevant past history, too. Vaccination status is critical, especially for parvovirus, deworming history, any travel history that might expose them to unusual infections.
Got it. So come prepared with as much information as possible. After the history, then comes the hands-on part.
Yes, the physical examination. The vet is looking and feeling for clues. They'll assess the pet's overall attitude. Are they bright or depressed? And importantly, their hydration status, checking gum moisture, skin elasticity, how sunken the eyes look.
Okay.
A really careful abdominal palpation is key. They're gently feeling the belly for any signs of pain. Is it localized to one spot or generalized? Are any organs enlarged? Can they feel a lump or mass that might be a foreign body, a tumor, or maybe that telescoped intestine? Intussusception.
Feeling for clues inside.
Exactly. Is the belly distended with gas or fluid, which could suggest a blockage or GDV? They're feeling for thickened loops of bowel. They'll also check the mouth for foreign material or sores, listen to the heart and lungs, take the temperature, maybe do a quick neuro check, and possibly a rectal exam.
And sometimes, even if something serious is brewing, the exam might seem normal initially.
That's an important point the sources make, yes. Sometimes the physical exam can be deceptively unremarkable early on, even with significant underlying disease.
So even with a detailed history and a good physical exam, you often need more data.
Very often. If the history and exam raise red flags like significant dehydration, severe lethargy, obvious abdominal pain, fever, not eating, or if the vomiting is just really frequent or persistent beyond a day or two, then the sources say it's time for a minimum database of diagnostic tests.
Okay, what's usually in that initial batch of tests?
Typically three main things. First, a complete blood count, or CBC. This looks at red blood cells, white blood cells, platelets. It can show signs of dehydration, packed cell volume goes up, inflammation or infection, white cell counts change, anemia, which might suggest bleeding like from an ulcer. Second, a serum biochemistry profile. This is a panel that looks at markers for organ function, especially kidneys, BUN, creatinine, and liver enzymes. It also checks blood glucose, sugar levels high in diabetes, low in other problems, electrolytes, those crucial salts like potassium, sodium, chloride key for spotting Addison's or dehydration effects, protein levels, and sometimes pancreatic enzymes like amylase and lipase, although...
Are those pancreas tests reliable?
Well, amylase and lipase can be elevated for other reasons too. The sources highlight that there are more specific blood tests for pancreatitis now, like the CPLI for dogs or FPLI for cats, which are usually preferred if pancreatitis is high on the list. The biochem panel also checks calcium levels.
So CBC for blood cells, biochem for organs and electrolytes. What's the third part?
A urinalysis. Analyzing the urine gives information about kidney function, how concentrated is the urine, hydration status, can detect signs of infection, check for glucose or ketones, which point to diabetes, and sometimes even find crystals that suggest certain toxins, like ethylene glycol.
So blood and urine together give a really good snapshot of the pet's overall internal health and hydration. What about looking specifically for gut problems like parasites?
Right, a fecal examination is often included, especially if there's diarrhea too, or if the pet isn't well dewormed. Looking for parasite eggs or organisms like Giardia. And for young, sick puppies, a specific fecal test for parvovirus antigen is essential.
Okay, that's the minimum database. If those tests don't give a clear answer, or if they point towards something structural in the abdomen, what's next?
Then you move into advanced diagnostics, often starting with imaging to actually see inside the belly.
Like x-rays.
Exactly. Abdominal radiographs, x-rays, are very common. They can show things like metal or dense foreign objects, abnormal gas patterns like dilated loops of bowel suggesting an obstruction, or the classic signs of GDV. They can sometimes show masses or fluid accumulation suggesting peritonitis.
What about things x-rays don't show well, like soft tissues?
That's where ultrasound comes in. It uses sound waves and gives much better detail of the soft tissue organs. You can look closely at the layers of the stomach and intestinal walls, examine the pancreas, liver, kidneys, adrenal glands. It's great for finding things like non-radiopaque foreign bodies, intussusception, tumors, or fluid. It can also guide procedures like needle aspirates.
So x-rays for bones, gas, metal, ultrasound for organs and soft tissues.
Generally speaking, yeah. Sometimes contrast radiography is used. If an obstruction is suspected, but not obvious on plain x-rays, the pet might swallow a contrast agent, like barium, and then serial x-rays are taken to see how it moves through the gut, or if it gets stuck.
But you mentioned a warning about that.
Yes, a really critical one from the sources. Barium should not be used if you suspect a perforation, a hole in the GI tract. If barium leaks into the abdomen, it causes severe inflammation. You'd use a different type of contrast agent in that situation.
Good to know. What about actually looking inside with a camera?
That's endoscopy. A flexible camera goes down the throat into the esophagus, stomach, and the first part of the small intestine. It allows direct visualization of the lining. It can be used to retrieve some types of foreign bodies or to take small biopsies. It's probably used more often for chronic vomiting investigations than acute ones, unless a foreign body retrieval is planned.
And if all the tests point strongly towards something needing surgical intervention, like a definite blockage or GDV,
then exploratory laparotomy, basically abdominal surgery, is the next step. It's indicated when there's strong evidence of a surgical problem obstruction, GDV, suspected gut rupture causing peritonitis into susception that can't be reduced otherwise. It allows the surgeon to directly see what's wrong, take bigger biopsies if needed, and fix the problem surgically.
And I guess sometimes specific blood tests might be needed for rarer things.
Absolutely. If Addison's disease is suspected based on initial blood work, that specific ACTH stimulation test is the gold standard for diagnosis. If there's a history suggesting exposure to lead or antifreeze, specific tests for those toxins can be run. Sometimes tests for liver function, bile acids, or intestinal absorption, B12 folate, are needed too.
Wow. It really is a step-by-step process, gathering clues from the history, the exam, basic tests, then more advanced diagnostics as needed.
Okay, so once they have an idea of the cause, or even while they're still figuring it out, how do vets actually treat acute vomiting and get the pet feeling better? Well, the specific treatment obviously depends on the diagnosis, but for almost all cases of significant acute vomiting, symptomatic and supportive care is the absolute foundation. It's crucial while waiting for test results, or if the cause is something self-limiting that just needs help getting through it.
What does that supportive care mainly involve?
Top of the list is fluid therapy. Vomiting causes fluid loss, not drinking makes it worse, and electrolytes get out of whack. So giving fluids, usually intravenously, for moderate to severe cases, is critical to rehydrate the pet, correct electrolyte imbalances, fix acid-based problems, and just support circulation.
Makes sense. Replacing what's lost and keeping things running. What about food?
Usually the first step is MPO nil peros, which means nothing by mouth.
Resting the gut.
Exactly. Withholding food, and often water initially too, for a period commonly 12 to 24 hours, maybe longer, depending on the severity, just gives the inflamed stomach and intestines a break. The sources had a slight nuance. One suggested maybe only fast if vomiting is truly intractable and aspiration is a high risk, while another advised MPO and IV fluids for frequent vomiting. For you listening, it means it's not always a rigid rule, but generally resting the gut is standard. Once vomiting subsides, they might start with tiny amounts of water or ice chips.
And what about stopping the vomiting itself? Medications.
Yes, antiemetics drugs control vomiting are very commonly used. They help the pet feel better, reduce ongoing fluid and electrolyte losses, and hopefully allow them to keep down water and food sooner.
What kinds are used?
Meropitant, trade name Cerenia, is a very common one. It's broad spectrum, works on multiple triggers, and can be given by injection or orally. Ondansetron, Zofran is another good one, especially for severe nausea, sometimes used with chemo patients. Metoclopramide, Reglan, works centrally and also promotes stomach emptying.
But not if there's a blockage, right?
Correct. That's a key contraindication, the source is stress. Because it increases motility, it could make an obstruction worse. And remember, it's less effective in cats. There are others too, like mirtazapine, which also stimulates appetite, especially useful in cats. Some older drugs like chlorpromazine exist but have more side effects like sedation.
Important point that you mentioned vets use these carefully.
Yes, the sources caution that antiemetics can suppress the symptom, vomiting, and potentially mask the progression of the underlying disease. So they shouldn't be used blindly without trying to find the cause, and careful monitoring is still needed.
Okay. What about protecting the stomach lining if it's irritated or ulcerated?
Gastroprotectants are often used in those cases, or if ulcer risk is high, like with NSAI use. Things like proton pump inhibitors, PPIs like omeprazole, are very effective at reducing stomach acid production. H2 blockers like famotidine also reduce acid, maybe less potently. And sucralfate is a drug that forms a protective coating over ulcerated areas, but it needs an acidic environment to work, so timing with antacids matters.
And pain relief if the belly hurts.
Absolutely. If there's significant abdominal pain, like with pancreatitis or post-op, pain management is vital. Opioids are often the go-to choice, a key point from the sources. NSAIDs are generally avoided in pets with acute vomiting, especially if they're dehydrated or ulcers are suspected, as they can worsen kidney issues or stomach irritation.
Okay, fluids, gut rest, anti-vomiting meds, stomach protectants, pain relief. Once the vomiting is under control, how do you get them eating again?
Nutritional support is the final piece of supportive care. It's usually done gradually. Start with small, frequent meals of something really bland and easy to digest.
Like boiled chicken and rice.
That's the classic homemade option, or vets have prescription commercial GI diets that are balanced and highly digestible. The goal is just to provide calories and nutrients without overwhelming the recovering gut. The sources emphasize that getting some nutrition in early, once vomiting allows, is actually good for gut healing. If a pet refuses to eat for a prolonged period even after vomiting stops, assisted feeding via a tube might be necessary. Then, over several days, you slowly transition back to the regular food.
And of course, if a specific cause is found, it needs specific treatment on top of all that support.
Exactly. If it's a foreign body or an obstruction, surgery is usually required once the pet is stable. GDV needs emergency surgery to derotate the stomach, plus often a gastropexy to tack it down. Severe pancreatitis needs aggressive fluids, pain control, antiemetics, and careful nutritional management. An Addisonian crisis requires specific IV fluids and hormone therapy, corticosteroids, mineralocorticoids. Acute kidney injury needs targeted fluid therapy, sometimes dialysis. Toxicities might involve specific antidotes or decontamination procedures, and antibiotics are used if a bacterial infection is confirmed or strongly suspected, like with parvo complications or sepsis.
It really drives home that treatment is highly individualized. So once treatment starts, how do vets track progress and what's the general outlook?
Monitoring is absolutely key, especially for hospitalized patients. They're watching hydration levels constantly, checking if the vomiting has stopped or lessened, seeing if appetite returns, monitoring urine output, checking vital signs like heart rate and temperature. Repeating blood tests, especially electrolytes and kidney values, is common to ensure things are moving in the right direction.
And the prognosis. I imagine it varies wildly.
Hugely. It depends entirely on the underlying cause. Simple dietary indiscretion, usually an excellent prognosis with basic care. But life-threatening conditions like GDV, severe untreated pancreatitis, acute kidney failure, or sepsis. Those carry a guarded to poor prognosis unless they get very aggressive, timely intervention. For many of the less severe causes, though, recovery can be quick with the right supportive care and diet management. Foreign body surgery generally has a good prognosis if done before major damage occurs.
And I suppose some prevention is possible for certain causes.
Yes, the sources mention common sense things like trying to prevent dietary indiscretion, keeping garbage secure, supervising pets with toys they might swallow, avoiding sudden, drastic diet changes. Using highly digestible diets might help some pets prone to upset.
And always being aware of those potential complications if things don't resolve quickly.
Right. Dehydration, electrolyte chaos, aspiration pneumonia, esophagitis. They remain risks if the vomiting persists or the underlying cause is severe. And that risk of masking progression if antiemetics are used without addressing the root cause.
Wow. Okay, this deep dive really hammered home how something as common almost every day as a pet vomiting can actually be the tip of a very complex iceberg. It's definitely not just a stomach bug half the time.
It really underscores why veterinary evaluation is so important. If a pet is vomiting more than just once or twice, or if they seem unwell in any other way, it takes that professional investigation to sort through that massive list of possibilities.
And hopefully, understanding this whole process, the history, the exam, the tests, the treatments, gives you, our listener, a much clearer picture of what your vet's thinking and doing when your pet is facing this issue.
Helps demystify the process a bit, yeah.
So here's a final thought to leave you with. We've talked about this incredibly long list of potential causes, everything from eating trash to rare metabolic diseases to swallowed socks. And we know some of these need incredibly fast action. So how does a veterinarian, faced with that vomiting dog or cat, make those critical decisions about which diagnostic test to prioritize? How do they efficiently narrow down that huge list to find the specific cause quickly without running every test under the sun, but also without missing something urgent?
That's the real art of veterinary medicine, isn't it? Combining the science with clinical judgment and experience.
It certainly seems like it. Thank you so much for joining us for this deep dive into acute vomiting. We really hope you found it useful. Keep exploring, keep learning.